rabbits and chickens in the office. And so, of course, with all the animals we work with, we need to know also how to take care of them. So today, Dr. Susan Brown, an exotic veterinarian, is going to show us how to do a physical exam on a rabbit.
Hi, my name is Dr. Susan Brown, and I'm here with Jenna, and we're going to examine a rabbit. This is Lena, who is visiting with us from, I'm going to say it, Sacramento Animal Control. Is that the name of the, yeah, okay. Who's visiting with us, who's going to participate in the exam. So if you'll notice right now, if you can see, get a little close-up of her, how quickly she's breathing, how she's sort of vibrating, breathing quickly, ears forward. And if you could even see her ears, her blood vessels are pretty dilated in her ears. She's a pretty toasty little bunny right now. It's not so hot she's going to overheat, but we're going to get through the exam fairly quickly because we'd like for her to get back into where it might be more comfortable inside. So when people bring their rabbits into you, they may bring them in a cage like this or some kind of a carrier with just a front door on it. The best way to get them out is if the front door opening is quite small, like it is in this cage, is basically to take the top off the cage or the carrier. So we've already loosened this up here. We're going to take the top off. And one of the things I can tell you about bunny rabbits, unless they have a vision problem, they don't tend to jump off of tables. They don't tend to jump out of high cages either. So I'm not really frightened that she's suddenly going to jump off of the table. You'll also notice right now that she's sitting in her litter box. Rabbits often will like to sit in their litter box because it feels a very secure place to be. So you can use that to your advantage sometimes. You can, in this case, it's a cardboard litter box, so it's a little hard to move. But a nice heavy plastic litter box, you literally could lift the whole litter box out and put that on the table and let them, start your exam from the litter box itself. But in this case, because this litter box is more flimsy and it's not going to lift out very well, it will fall apart, we're going to lift her out not with the box. Now, you'll see what she's done is she's assumed a position sort of crouched down. She was sitting up before, she's still breathing rapidly, but she's sort of crouched down. This is a position, she's not all the way into a freeze position as if she's invisible, but she's sort of waiting to see what's going to happen. One of the places that rabbits usually, if they want to be touched, enjoy being touched, is right here between the ears and right on the forehead, sort of between the ears. And one of the things I can do is just put a little light pressure there, just pet her there a little bit for a moment just to calm her and feel what her body is doing, how tense it is and all, just to get her used to me touching her rather than just grabbing and picking her up. All right. There's several ways to pick up rabbits. I'm not going to go through all of them. But one of the ways, it's fairly simple. I'm going to shift her around a little bit. All right, and she's still in her box. Just let her be calm. And I'm going to take my hand like a shelf, and I'm going to put it under her front feet. Okay? I don't need to grab her front feet tightly. It's just like a shelf. Then I'm going to take my other hand, and I'm going to scoop up under her hind end. I'm going to let you now remove that. I've got fingers on her hind legs here, so she's feeling that she's got her weight on my front hand. She's got some weight here, so she's not dangling in the air, and then I'm going to place her down. Okay? This is not a trained rabbit. This is not a rabbit that's been handled a lot as far as I know. She's fairly young. It said 3 months. I'm guessing maybe closer to 4 to 5 months. She's a decent size right now. Her head looks a little smaller than the rest of her body because she's not fully grown yet. All right, so putting a towel on the table or some kind of a surface where it's not slippery. Putting her on the slippery table is not only difficult for her and scary, it also can be quite loud with their nails, and they have very sensitive ears. So I'm going to let her just explore for a minute while we're talking. And at this point, I might be talking to the client, gathering some information. I can touch her periodically, just let her explore. If you wanted to use some treats, if the owner brought some treats or little pieces of fruits or vegetables, you could put those around and let her have those. But quite honestly, unless this rabbit is very, very used to being around people, just like dogs and cats, they often won't take any food when they're terrified. So I don't think she's quite terrified, but that is certainly something else you can do, is have little things around that she can eat. Okay, so we're going to start our exam, and I can tell you that for most rabbits, certainly there are exceptions that are very, very frightened, but for most rabbits, the veterinarian or the technician can do the majority of the exam by themselves with very minimal restraint. So what I'm going to do, I'd never pick the rabbit totally up with all 4 feet dangling. If I want to move the position of the rabbit, I'll sort of move her in sections like this. So she always has 2 feet on the ground, and she never feels like she's dangling in the air. For a rabbit to be dangling in the air would be a rabbit that might be about to be eaten by a predator. You know, that's why they would be dangling in the air. They don't climb trees, they don't fly through the air. So they would always have all their feet on the ground. Okay, so you can start wherever you'd like. I usually like to start at the head. You can use additional lighting. For instance, here, if I couldn't see the eyes very well, the lighting in the room, I could put a light on them. They tolerate that very well. But I'm going to start with the head, and usually start with the ears. Take a look inside the ears. Like I said, we can put our light in there. Take a look down inside the ear. You can see quite well inside the ear canal. You can look at both ears from the same side. You could put an otoscope, what did I just do with it here, and go ahead and look all the way down in the ear if you felt that there were problems in the ear, you saw any kind of discharge. Lop-eared rabbits that have ears like this more frequently have excess wax in their ears and may have problems. Upright rabbits don't tend to have as many ear problems other than things like ear mites. Okay, so we looked at her ears. You can see she doesn't really mind. It's not a big deal for her. Now I'm going to take a look at her eyes. They actually will let you pull back the eyelid so you can look at the whole eye. And I'm going to do it on this side so you can see it in just a minute. But they have a third eyelid that sort of pops forward. That helps clean the eye, and it moisturizes the eye and all. They have a very large tear duct, and you actually can also flush their tear ducts if you need to, just with a little anesthetic in the eye, and you can usually do it with them all the way awake. All right, so I've looked at her eyes, and I'm looking for, rabbits can develop upper respiratory infections, so I'm looking for any discharge, any clumping of hair around the corners of the eyes, and her eyes are very, very clean. The next thing I'm going to want to look at is her nose. So I'm going to need to get down a little bit, and I'm going to take a close look at that nose. Now, the fact that she's hot, it's going to be a little wet around her nose. That's fine. What I'm more concerned about is if I see whitish material, clumps of mucus, any greenish, yellowish, those sorts of things around. Now, sometimes people will tell you the rabbit has been sneezing, but yet they come into your clinic, the rabbit isn't sneezing anymore. How do I know if the sneezing is really a problem? Was it just watery material, something was irritating, or is it actually a respiratory infection? Well, the place that you're going to look is on the inside of the paws. I'm going to lift her up just a little. You don't normally have to, but right in this area here on both paws, you'll see that the hairs will be stuck together if they've got a lot of mucus and stuff coming out, because what will they do when they rub their nose? They're doing this when they're cleaning their nose, and all that material will get stuck here. So it's a great way of finding out if, in fact, they have a chronic runny nose, which might mean some type of respiratory infection. So we also can take a look at the front teeth from this position, but I'm going to choose at this point we're going to look at the back teeth in a minute. I'm going to look at them at the same time I look at the back teeth, which will require an assistant, and that'll be the last thing we do. All right, I can now then, very important in rabbits because they can have dental problems where the roots of the teeth can get too long. I'm going to take my hands at the same time, and I'm just going to feel along the bottom of the jaw and compare both sides, make sure that they're equal, that there's not a lump on one side that's not on the other side. And then I feel along the side of the jaw, and then I can just gently take my hands and just come up around the eyes like this too, because if there's abscesses to the roots of the teeth here, you'll feel lumps in all these areas, okay? So she's handling this beautifully, not doing too badly. I just move her out a little bit. Now the next thing I'm going to do, I tend to put her away from me like this. Now let her get comfortable. If she wants to hop for a minute, that's fine. Okay, I'm going to bring her back. And sometimes if you stretch out her front legs a little bit and get her into a flatter position, she may stay a little better. So I'm going to just gently feel around her neck for any issues with lymph nodes. I'm going to take my fingers under the front legs and feel in the sort of armpit area for any lymph node problems. Okay, nothing there. Then I'm going to want to take a look at this fur. And it's nice to have a good light on here, but rabbits can have fleas, rabbits can have fur mites. And the fur mites will appear, it's called walking dandruff. You'll see big flakes of dandruff usually along the back of this area here. And if you look closely with a bright light, you can often see the little mites walking around. And those are all taken care of pretty easily with things like Revolution. So I'm going to just sort of, as I'm looking at the fur, I'm also feeling what that skin feels like. Are there any lumps, bumps, bites? Rabbits will fight with each other, and often you can get little bites, okay? So I've looked at most of the top side that I want to look at. Now I can see her tail and everything. I need to take a peek at the underneath side. So I'm going to do that by simply, again, making that shelf with my hand. If you want to, you can put your finger between the paws, that's fine too, but you're not grabbing. You're not grabbing onto, that's really important. Once you start grasping, they may start fighting you. So I'm simply going to lift her up against me, all right? She's on her feet. I'm going to tilt her back just a little bit so she's sort of sitting on her butt, and she seems pretty comfortable. Then I can move the fur right here. And then I can take a look right around the perineal area and see if she's a boy or a girl. Okay? So I'm looking, I know you can't see from over there, but this is a girl. Okay? Also, if it's a boy and his testicles are down, you'll be able to, feel those testicles there. Those of you who are standing right here, can you smell the smell right now? Her little scent glands are open. She has a little scent gland right on either side of where the reproductive organs are, and her little anal area is right above where the reproductive organs are. It's all sort of with fur here, okay? But no abnormalities there. It looks good. I can look at her underneath side. I can take a peek at the bottom of her feet, okay? I can take a peek at the feet here. All right. Let's finish, like I said, you could do this before or after you picked her up. Let's go ahead and finish the exam with an abdominal palpation. Now, rabbits have a very short chest. It's only about this long from here. The back of her rib is here to here. It's quite small, and so she has a very large abdomen. That's because of the type of GI tract they have. Generally, they will just sort of lay into your hand, and you can easily feel their abdominal organs. If she wants to move, then you can try putting another hand on top of her with gentle pressure here, even a little massage here while you're using your other hand to palpate. You should be able, now you see her raising her back end up a little bit. This is why you don't want the back end pointing towards you, because she may decide to pee, and if she does, it'll come out really suddenly. So don't point it towards the client either. Or scoot her back a little bit. Okay, so anyway, I'm palpating her abdomen. It should be very soft. I should be able to feel kidneys, bladder, some of her intestinal tract, and the edges of her ribs to see that her liver is not enlarged. And then, did we get a stethoscope? No. Okay, that's fine. It's simple enough with a stethoscope. Where you're going to listen to the heart is similar as in other animals. You go right where the elbow, the corner of the edge of the elbow right there, the point of the elbow is what I mean to say, and you're going to put your stethoscope here, certainly on both sides. Take a listen. The biggest issue when listening to rabbits' heartbeats is this rapid breathing. Now, the last piece of the exam is where I'm going to want to look at her back teeth. Rabbits' teeth grow throughout their life. So with them constantly growing, we can get overgrown molars, overgrown incisors, all kinds of problems. So we want to at least take a quick look at those teeth even while she's awake. If we had some dental problems, if we had any serious problems at that point, she would be sedated and we would look even more closely. But at least with this, we can take a peek and we can see if there's anything to be concerned about. All right? People can use either an otoscope, or they can use what we call a vaginal speculum. The head fits on here the same, but it has two blades. Either one can be used to look at the teeth. So I'm going to use my assistant Jenna here, and I'm going to pick her up, as I mentioned, as I showed you before. and I'm going to turn her around. You're going to support her back legs, and you're turning her towards me. And we're not going to grab her back legs. We're just going to sort of let them sit, okay? And I would have you put her straight up against you like this. Perfect. All right? This is not something it's not painful, but it's not normal to have things stuck in your mouth. So it's not like she's going to stand perfectly still for this, and we're going to have to be fairly quick. Before I look in the back, she's like, what are you going to do now? I've had enough. Before I look in the back of her mouth, though, I'm just going to lift up her lips, and I'm going to take a look at these front teeth, okay? And the front teeth look great. The upper teeth should be overlapping the bottom teeth. Also, you're not going to be able to see it at all because they're very tiny. But in rabbits, there's actually two sets of upper incisors. There's the big ones you can see in the front and something called peg teeth in the back that are very tiny and they're very short. But I would be able to see if those were long. So now what I'm going to do is take a look at the back of her mouth. And I'm going to have to sort of be in your way. So I'm going to hold her head. I'm going to put this in the side. And I'm going to take a look, okay? And I can look at her molars, okay? And then I give her a break. She said, oh, that just didn't taste good at all. All right, and then we want to go in the corner on this side. Yeah, and I can see all the way back and along her tongue, okay? And we can go ahead and set her back down. Thank you. And that's really the only part you need an assistant for. If you use these kinds of otoscopes that are plastic, over time they will get little burrs on them from the rabbit chewing on them, and you'll need to keep those filed down or they can be very rough inside the mouth. So that's the only issue there. All right, so we finished our exam, and I'd like to show you just quickly how to, because this little bun, as we know, is pretty toasty. I'd like to show you how to do a nail trim, and I do need to give credit to Mary Cotter from the New York, from the Rabbit Rehab and Rescue, I believe is the name of the group, out of New York, for showing me this way of trimming rabbit feet, and because she did a great job with that. So I'm going to pass that along to you. Certainly there are different ways to do it, but I'm going to quickly mention we prefer not to put rabbits on their backs anymore. That's something we've all done. It's not that it's going to kill the rabbit, but a rabbit on its back is not a natural position for a rabbit to be in. And rabbits on their backs need to, that would be a position they'd be in about to be eaten by a predator. We know it's more stressful for them. Yes, there may be times when you might do that very briefly, but generally if we can avoid that and trim their nails, and trim their nails in other ways where they can sit in a normal position, that would be preferred. So Mary developed this technique, and which I'm going to try to demonstrate, not try, I will demonstrate to you now. All right, now what you can do, you can either be seated in a chair or have the animal up on a countertop. You teach this to clients so they can do this at home. I have her at this point on a countertop. Again, we want to have a surface where the rabbit feels comfortable. So a towel in your lap or a towel on the countertop. Okay, these aren't my preferred type of clippers, and that's fine. I prefer to have the little cat clippers that look like a pair of scissors, but they have the little carved out areas where you trim the nails, but we certainly can use these. So we're going to start with the front nails. One of the things, bunnies do like to have a little, when they're lying next to each other, they like the security of having a little pressure against them. So you can sort of lean forward and put your arm, sort of get them, this is not really tight, but we're just helping them feel secure. And get your hand behind the elbow and push this foot forward, okay? Now I am grabbing the foot per se, like lightly. Mostly I have my hand behind it, I don't know if you can see, and I'm just putting pressure on the elbow forward. Okay, I'm not grabbing and holding the foot tightly. And then if she wants to pull it back, that's fine. Well, I've held it sort of a long time while I was chatting. So we're going to move that foot forward, okay? Now, if you need to see the nails better, these nails actually don't need to be trimmed. They're not particularly long, so there's not much we're going to trim. But you can just take a little bit of water and you can push back the hair, okay? Now, I know she's hot. Let me let her just take a minute. All right. So generally when I'm cutting rabbit nails, I will cut them about at the same length as the hair. So right now you can probably see she doesn't have any nails sticking out beyond the hair. And so I don't always wet it down because I just sort of cut it at the length of the hair and I use that as my guide. Let's say she has a nail sticking out here. I'm going to pretend that I'm cutting a nail. So whatever kind of clippers you use, you would place them on the nail, and you want to do something before you actually clip through. You want to press, press, and then clip all the way. Now why would I want to do that press, press first? Because it'll tell you if you're too close to the quick. Even though it may look like you're not in the bloody area, in the area of the nail with a blood supply, it may be painful to her and there may be a little nerve sensation there. So if you press without clipping all the way through, just put pressure, pressure, then you know if it's hurting her, she'll pull her foot away. Great, no damage done. I then can go back, move my position, do it again. Doesn't bother her, go ahead and clip. And you're not going to have bloody nails and a rabbit that's terrified to having its nails trimmed, okay? So again, you're going to push that leg forward. You're just basically very light hold on that. You're going to find your nail, press, press, clip. Press, press, clip. Okay? And her nails, like I said, are really short. There's nothing to trim. No problem there. Now, how do we do that inner foot? The inner foot, depending on the size of the rabbit, there may be a little bit different ways of doing, but you can either lift her all the way up like this, and I don't know if you can see from this side, I'm actually taking my fingers, and again, this foot is just supported, and I'm taking my hand behind this elbow. She said, I'm getting tired of you messing around here, and I'm just pushing that foot forward again, okay? So she's up against me, I'm pushing forward, so I can actually see the foot. It doesn't have to be that far forward. Same thing, press, press, clip, press, press, clip, and you can go around and get all those nails. Okay? Simple. Give her a little bit of a break. So you don't have to turn her from side to side. You could if you wanted to, if you had problems manipulating, getting that inside foot, but you don't have to. Now, the most fun part is doing the back nails. So again, remember the shelf with your hand. We're going to lift her up. We're going to let her lean against us. We're going to let her get her weight on the inner foot here so she feels balanced and she doesn't feel that she's just hanging in the air. And we're going to jiggle this foot out and we're just going to rest it there. Okay? And again, you can use your water to push this back. She has very short nails. They're not sticking out at all. It's exactly the same procedure. You'd see the end of the nail, press, press, clip, press, press, clip, press, press, clip. And you know, I'm touching her nails right now, and I'm pressing on them, okay? I'm not cutting them yet, but I'm just showing you how little movement you get, that she'll just, now that one, she said that bothered me a little. I'm pressing out here. She doesn't care, okay? When you're done with that foot, you put that back. You let her lean onto that foot to feel secure. Then just gently jiggle this foot out. A little more weight over there, perfect. She had too much weight on this one. I leaned her over a little bit, like that. And there's her foot, and you go ahead and clip that. Done. All right? So very simple, without putting her on her back, without making her feel insecure. She got her nails trimmed in a very simple manner with no problems at all. Okay? So this is our little girl who's quite toasty, and we're going to get her back into some air conditioning so she can cool down, and we really appreciate her cooperation and being so patient. Thank you.